clear.
Good evening. I call the meeting of the Government Operations Committee for Monday, June 20th, 2022. Sharon, can I have the roll call, please?
Hayliger?
Here.
Bongard?
Here.
Bancroft?
Here.
Lencioni?
Here.
Petrilla?
Here.
Werbaum?
Here.
Bessner?
Here.
Weber?
Here. Thank you. We have item 3, administrative. Video gaming May 2022 information. Any questions or comments on that? Okay, thank you. We do have no omnibus vote tonight, so we'll go to straight with 5A, recommendation to approve the funding allocation request of the St. Charles 708 Mental Health Board for fiscal year 2022-2023.
Thank you. As the council is aware, the city levies a specific property tax to support mental health services in the city of St. Charles. This tax has been in place since 1986, and the city's 708 Mental Health Board administers the funding application process and recommendations for award of those funds, which for this year is $612,003. I'd like to, at this time then, introduce Kaylin Paremba, the chair of the Mental Health Board, to discuss the funding process and allocation recommendations.
Good evening and welcome.
Good evening. My name is Kaylin Paremba. I'm the chair of the 708 board. Thank you for the opportunity to speak with you all this evening. I'm excited to present on behalf of the 708 team our recommendation of approval of the funding allocation request for fiscal year 2022-2023. The mission of our board is to serve the residents of St. Charles with funding local, community-based, high-quality programs and services for citizens with mental health needs, substance abuse needs, and developmental disability. The board coordinates through an application process, which includes presentations, priority discussions, and analysis of data for allocation decisions for our qualified agencies. Please see the attached listing for all the specifics. This year we had 19 applicants, 2 new agencies, the Joshua Tree and Horsepower Therapeutics. This year resulted in approximately $612,003 allocated for recommended funding. Our ask this year was $812,001. 7 of our organizations have been recommended to receive more than $25,000. They are as follows. Association for Individual Development, Casa Kane County, City of St. Charles Police Department, Ecker Center for Mental Health, Lazarus House, Lighthouse Recovery, and Tri-City Family Services. As you are probably aware, the COVID-19 pandemic has placed an excruciating burden on the mental health community. In 2021, approximately 4,610 residents were served by the agencies who are receiving 708 funding. This is a 44% increase in the number of residents served in 2020. Time and time again, we heard from our agencies that they simply needed more money to expand the number of staff to meet the need in our community. Opioid use, substance abuse, eating disorders, and developmental delays are just a handful of the most pressing issues in our community.
Okay, thank you. Just know we do have 7 members of the groups that received over $25,000 are in the audience. If we have any questions, or any questions? Yes, Rita.
Thank you, and thank you to your group. I have a question, but it's probably more for Heather or Bill. I'm wondering why we're no longer privy to the details of who gets what. We used to get a whole packet of information and included how many citizens are served, how they were served. I know you guys get it, and I know you guys put it out there, but where is it? Yeah.
Last year was the first year that we didn't post all those applications, and that could certainly be up to Bill. I did not present those to him as part of the packet.
Well,
because
here's
of
my other concern too, is that I think last year I was able to go online and look up the minutes for the group, and that there's been no minutes posted since March. So that's my concern. Maybe I was able to resource it last year, but I haven't been able to this year. And that's not on you, I know. Yeah, that's what I'm asking.
I was unaware that the minutes were not posted, but I'll make sure that those get posted.
Okay, yeah. Well, that's what I'm asking, I guess, Heather.
Yeah, it's certainly something we can correct. It was my understanding that they were following past protocols on it, but we can make sure to adjust that and get that information.
Yeah. No, yeah, this last year was the first year that it wasn't. And I know that the team does a great job of explaining and saying, you know, this is how our residents are served. And maybe if we could get something before, you know,
yeah, I'm happy to send that. I'm happy to send that supplemental information out this week before it goes to city council for
Thank
approval.
you so much. Okay, thank you, thank you.
Thank you, Rita. Any other questions or comments from the committee? Okay, thank you.
Thank you.
Okay, see no more questions, then I have a motion second to approve this.
Move for approval.
Moved by Dave, seconded by Brian. Roll call, please.
Bancroft.
Yes.
Lencioni.
Yes.
Petrilla.
Yes.
Wirball.
Yes.
Bessner.
Yes.
Weber.
Yes.
Hayleitner.
Yes.
Bongard.
Yes.
But can I just say that I don't want it to automatically go on omnibus for council now, that I would still like to
Noted.
have it discussed. Thank you.
Okay, thank you. Okay, that motion passes. Thank you. We go to 6A, recommendation to approve a resolution to establish a section 115 retirement health savings plan for St. Charles Professional Firefighters Association, IAFF, Local 3322. Good evening.
Good evening. This item is before you today pursuant to our existing collective bargaining agreement with the IAFF, which represents our firefighters. Part of that agreement was that the city and the union would meet to bargain in good faith over establishing specific terms and conditions for a retirement health savings plan. And one of the reasons that the union is interested in this is simply because a lot of times, based on how their pensions are structured, they retire at a younger age, and it's quite a journey to get to that Medicare age. And so this type of plan allows them to set aside dollars and have those dollars invested tax-free, and then have those distributions after retirement pay for things like health insurance premiums or deductibles or co-pays. We already work with the consultant that would be working with the union to manage this plan, manage the investment strategy, manage the disbursement of funds for any claims, and we've had a successful relationship with that particular consultant. He does a lot of work with a lot of municipalities setting up a plan like this. So this would be for our bargaining unit employees for the firefighters union. And it has all the documents that are attached. I know there are a lot of documents. These are needed to set up this Section 115 trust. They have been reviewed by our city attorney's firm, who has done a lot of work with other municipalities and this particular consultant setting up this retirement health savings plan. And hopefully the city would save a little bit of money in terms of the taxes as well. So I am here to recommend that this is the resolution is approved by City Council, and I'm happy to answer any questions.
Any questions from the committee? Rita?
Yeah, I think you said it, Jen. I think it's an executive summary, but it comes out of their payroll.
Correct. So there
okay.
is no cost. There is no fees to the city.
Good.
The contribution comes from their paycheck and their vacation and sick time payout. There is no reporting that the city has to do. We simply have to deduct the money and send the funds over to the financial institution. And that's something that we're already doing actually on the police side, so it's also very minimal impact in terms of administrative functions.
Good. Thank you. That was great clarity. Yeah.
Thank you. Yes, please.
Jennifer, you said there would be some tax savings on our end. Is that in the form of payroll tax? Or?
Yeah, exactly.
Okay. Thank you.
Thank you. Okay, see more questions. Could I have a motion and a second, please?
Weber,
Moved by Paula, second by Steve. Roll call, please.
Bancroft.
Yes.
Lencioni.
Yes.
Petrilla.
Yes.
Wirball.
Yes.
Bessner.
Yes.
Weber.
Yes.
Hayleitner.
Yes.
Bongard.
Yes.
Thank you. The motion
Thank you.
passes. Public comment. Okay, seeing none. Any additional items from the mayor, council, or staff? Okay. We do have an executive session tonight, so we'll go with item 9, collective bargaining. Any motion to go into executive session to discuss collective bargaining per 5 ILCS 120/2C2.
So moved.
So moved by Ed,
Second.
second by Brian. Roll call, please.
Bancroft.
Yes.
Lencioni.
Yes.
Petrilla.
Yes.
Wirball.
Yes.
Bessner.
Yes.
Weber.
Yes.
Hayleitner.
Yes.
Bongard.
Yes.
Thank you. That motion passes. We are now in executive session.